It will absolutely focus more on the individual discretion of all of us in the community to make appropriate choices for ourselves, to protect ourselves and protect those around us as we go about our day-to-day lives. The phase that we're in now is only possible because of the very high vaccination coverage that we've achieved. Really astonishing protection for our population and the many millions who've been vaccinated right through this pandemic, but in particular the third doses that have been given through the course of this year at GPs, pharmacists and state-run centres and all our community pop-ups. Just fantastic work to give us that protection that allows us to be here making these changes today. So I do want to thank every Victorian, every health worker, every person in our entire health system and everyone who's stepped forward to get a test or a vaccine. That collective effort has safeguarded our community and saved literally thousands of Victorian lives. We're now at a point where 19 out of 20, essentially on 95%, being double vaccinated. We've got 2/3 who are triple vaccinated. Indeed, amongst those who are eligible, because some have recently had COVID, it's above 70%. And we've reached that milestone in just 5 months. And the vaccine rates among older Victorians are even higher. Got 90% coverage for those over 70, 85% for those over 65, 82% for those over 60, really terrific figures. And it means we're in the best position to make a further easing of restrictions. It is significant, but it's a sensible one. It will allow us to get back to a better normal, help keep us safe at home, at school and at work, while we can still respond to the emerging risks. For the remaining restrictions, we're focusing on areas of highest risk, including to protect those who are most at risk in aged care, the disability care settings, and in other sensitive settings where mask wearing will continue to be required. The third dose vaccine mandates for our critical workers still remains in place, so healthcare, disability and residential aged care, police and emergency services, food distribution and in education. As a community, we also need to remember those basic and simple behaviours that are part of our everyday life and that will continue to work for this variant, for any future variant. Opening windows, good ventilation in our workplaces, homes and other settings will continue to be a protection. Wearing a mask indoors continues to be a protection, and staying up to date with your vaccine. Many countries have lived with restrictions for a long period of time. Some are still imposing significant restrictions. We had our restrictions to get to a point where we knew that we would be very substantially vaccinated as our really significant protection as a community. We're at that point here in Victoria with these vaccination levels. We've got enough inbuilt protection as a community that further restrictions are really not proportionate or necessary. Of course, there's more to do. We've still got 30% of people who, if they're not immediately due for their third dose, will be very soon or are recovering from COVID and should think about getting that third dose. For those who haven't had their third dose and are due, really now is the time to do it. There are 4 reasons to do so. Our cooler months are coming. We're going to have challenges in the healthcare system through winter, as we do every winter. The flu season will be one, but there are other direct effects of colds that mean people present with cardiovascular and respiratory conditions. And there'll be lots of other respiratory conditions circulating. So a good time to be protected from COVID. Your second dose protection is good protection against severe illness and hospitalisation, but it does wane over time. So if it's been a few months, now is that time to get the third dose to reboost your immune system for protection against COVID-19. Thirdly, there are still a lot of people with significant vulnerability to severe illness with COVID, those over 50, those with pre-existing conditions, those with weaker immune systems. If you're in those categories, you really should think about that third dose now. And lastly, while cases are plateauing now and we're very likely past the peak, we do still have broad community transmission, 10,000 cases per day. So it isn't behind us. We still need that additional protection as much as possible. So don't just rely on 2 doses through winter. Make April or May the time to get your 3rd dose. And as you know, there's a 4th dose recommendation for over 65s and some other at-risk groups that ATAGI has recommended. My mum's one of those. So as an 81-year-old, she got her COVID vaccine and her flu vaccine yesterday in the one appointment. So good on your mum. Please think about that if you're in those categories and get that dual protection through winter. Thanks very much.
Well, thanks, Brett. Happy to take questions.
How long do you think this can last if you prepared to put restrictions back on in winter, as Brett's just outlined, if things could put pressure on the health system?
Well, as we've outlined, very high rates of vaccinations give us the bedrock of certainty that allows us to take these measures today. We know that high levels of vaccination that Victorians have worked so hard to achieve give us the ability to take these significant steps today. Of course, we'll continue to monitor the situation, but we're pretty confident that continued high rates of vaccination have got us this far and will get us safely through the winter. But as Brett said, there's still a while that needs